Welcome back. In this video, we are going to study about sinus. The objectives of this session is to understand the causes of sinus, clinical features, investigations and treatment. Let us start with the definition of sinus. Sinus is a blind tract which is lined by a granulation tissue. So guys, you can see here this sinus is being lined by a granulation tissue. Okay. This is leading from an epithelial surface. It starts from an epithelial surface leading into the surrounding tissues. Sinus means a halo or a bay. So why do they call it a bay or a halo? So guys, basically bay refers to the sea which is covered by land on all the three sides. Similarly, the sinus is just a tract which is surrounded by all the surfaces, epithelial surface and the surrounding tissues in all its surroundings. So we call it as a bay. So you can see here, this is the epithelial surface, these are the surrounding tissues, and this is a small halo blind tract. This tract is nothing but sinus. Hope you got the definition. So we understood what is the sinus. Now let us see what are the causes for this sinus formation. It could be a congenital sinus such as preauricular sinus. So this is a congenital opening or a foramen which is located in the auricular helix. So you can see the helix of the ear here. So it is located in the auricular helix. This is a congenital malformation, okay? So you can see the preauricular sinus. Moving on to the acquired causes, we have actinomycosis. So guys, actinomycosis is a very rare subacute to a chronic infection, okay? It ranges from subacute to a chronic infection which is caused by actinomyces. This leads to sinus. So you can see a picture of actinomycosis here, leading to the sinus formation. Moving on to the next acquired cause, we have tuberculosis. So you can see that there is a picture here, the discharging sinus in the neck due to tuberculosis of lymph nodes. So the lymph nodes in tuberculosis, they form a cold abscess underneath, okay? So here you can see the sinus of a TB. This girl having a sinus of TB in the neck. So guys, what happens here, the bacteria which is causing the TB is going to cause the symptoms outside the lungs as well. It usually takes in the form of irritated lymph nodes or the inflamed lymph nodes. These round nodules around the neck, you can see here, these will drain the pus or a fluid which is in the form of sinus, okay? Moving on to the next cause, we have pilonidal sinus. What is this pilonidal sinus? Pilonidal sinus is a small hole or it's just a small tunnel in the skin at the top of the buttocks, okay? So here you can see in the picture very clearly a pilonidal sinus showing the primary and secondary sinuses here, okay? So what happens? Basically a cyst is formed which is later on leading to the sinus tract for the fluid, for the discharges to come out, okay? It forms a sinus. Moving on to the next cause, that is chronic osteomyelitis. What happens in chronic osteomyelitis? Basically, the chronic types will cause the bone pain. If there is recurrent infections in the surrounding tissues which are surrounding the bone, over the bone, then the drainage of the pus through the skin occurs from the infected bone, and the pus is going to drain out through the sinus tract. Similarly guys, in all the things, okay, so you saw here in the first place tuberculosis, what happened? They form a cold abscess, then that abscess burst open, forms a tract and the discharge is coming out. Then actinomycosis similarly, then pilonidal sinus, the pilonidal cyst forming, then forming a sinus tract. So basically understand what's happening inside. A cyst is formed or an abscess is formed, that is going to burst open, forming a tract, a blind tract, an unusual blind tract from which the discharges are coming out, which is nothing but sinus. So in chronic osteomyelitis, what happens? Recurrent infections of the surrounding tissues of the bone, and then those surrounding tissues of the bone will result in the formation of a tract through which sinus tract, through which the pus drains out. So let us see some pictures to have a better clarity about it. So this is a typical sinus in the thigh which is due to osteomyelitis of a greater trochanter of the femur. The greater trochanter of the femur bone, and this is osteomyelitis of the thigh. Moving on, femur bone. Okay. So moving on to the next picture, we have multiple discharging sinus foot, which is commonly due to mycetoma. So what's this mycetoma? Madura foot, popularly known as. It could also be due to the tuberculosis or due to pyogenic osteomyelitis, and even malignancies can result in the formation of these sinus tract and the discharging pus. The next acquired cause is median mental sinus. So you can see the median mental sinus here, which is a kind of a chronic condition where there is infection of the roots of lower incisor. So you can see here the root abscess. This is the incisors. So there is a root abscess formation, and through which what happens, the root abscess is going to form eventually, which will track down between the halves of the lower jaw, presenting as a sinus in the midline. So you can see here, which is in the midline they are forming a tract, and then the discharges occur. These discharges you can appreciate here in the next picture. So very clear guys, what's happening? There is an abscess formation, that is incisor teeth, lower incisor teeth forming a root abscess. How is this abscess forming? It is because of the infections of the roots of the incisor teeth, resulting in the abscess formation, later on resulting in the sinus. Moving on to the clinical features of sinus. I know this is a picture of ulcer. You might be wondering why have she put it in sinus. It is because for the understanding. So you need to know what is base, what is floor, edge, margin, how it looks like in a sinus. So let us see how it represents. The clinical features, we have the discharge from the opening of sinus. So from the previous pictures you will be knowing the clinical features. So you just have to apply your all the learning what we did so far, and then think about the clinical features. What could it be? In the first place, we saw the discharges coming out from the sinus. So the first point will be, there are discharges from the opening of the sinus. The sinus does not have any floor, so we did not see any kind of floor there, unlike the ulcers. So there is no floor, this part is absent. Okay, let us mark it here. There is no floor, and then we had the discharges coming. Moving on to the edge. Now let us see how are the edge in the sinus. In the sinus, the edges are going to be raised, indurated edge. Indurated, what did I say you from the previous videos? That indurated means hardness. It's gonna be very hard, the edges are hard. Indurated base. What is base? On which the sinus is resting, the part. Okay, now here you saw the median mental sinus. So the mentum, the lower jaw is the base. So similarly, osteomyelitis of the thigh, the femur bone is the base. So the part on which the sinus is occurring is the base. So even the base is going to be indurated, and it is non-mobile. It's not movable. Moving on to the granulation tissue. How is the granulation tissue formation in the sinus? Is it healthy? So let us check. They are saying a sprouting granulation tissue over the sinus opening is seen. Moving on to the next point, bone thickening in osteomyelitis. As I told you that there will be induration, and similarly in osteomyelitis there is going to be bone thickening. The surrounding skin of the sinus is erythematous in inflammatory sinus, and it is going to be bluish in color in case of tuberculosis. It is going to be pigmented in chronic sinus. Okay, if the sinus is of a longer duration, if it is a chronic sinus, it is going to be pigmented. So guys, let us revise. We have the discharges coming, there is no floor, the edge is indurated, the base is indurated, it's a non-mobile sinus, and then sinuses are non-mobile. The granulation tissue is often sprouting. Bone thickening may be observed. The surrounding skin will be erythematous in inflammatory, bluish in TB, pigmented in chronic. So the clinical features are very clear to us. Moving on to the next points, we have the discharge, which is typical of the cause. So if there are TB, the typical cause will be there. Actinomycosis, the typical discharge of that condition is going to be observed. It will be evident, which will be obvious after applying the pressure over the surrounding area. So you saw in the pictures, just a little, sometimes spontaneously it comes out, and if you want to see the discharge sprouting out, you just have to put a little pressure to the surrounding area and you can see the discharge is coming. Thickening of the bone underneath on palpation is seen if the sinus is adherent to the bone. So in cases where there is sinuses because of the, like let us consider the chronic osteomyelitis resulting in the sinus. So the bone is going, if the sinus is adherent to the bone, if on palpation you can find that there is a thickening of the bone. Also if there is osteomyelitis. Enlargement of the regional lymph nodes can also be seen. It will be evident. Sinus may be single sinus or there can be multiple sinus, like we saw in the foot, Madura foot, multiple sinuses were there. Now let us understand what are the cause for this persistence of a sinus. Why is it been there like for a longer duration? Why is it not getting cured? What is the cause for the persistence of the sinus? There could be a foreign body or a dead necrotic tissue underneath, such as a suture being caught underneath, or there can be a sequestrum, okay, a dead bone. There can be an insufficient or a non-dependent drainage of the sinus. There can be a lack of rest or persistent infection resulting in the sinus formation, okay, resulting in the persistence of the sinus. So guys, I hope it's clear. Persistence, foreign body, insufficient drainage, no rest, continuous infections, recurrent, persistent, again and again leading to a chronic condition. It will lead to the persistence of a sinus. The walls can become lined with the epithelium or endothelium. Dense fibrosis will prevent the contraction and healing. So if there is a dense fibrosis of the surrounding tissues or the tissue, then if there is sinus, then it cannot heal because the contraction doesn't occur. It is preventing the contraction. The fibrosis, the scarring is preventing the contraction. The specific infections could be the tuberculosis or actinomycosis, which are causing the persistence of an infection. Until and unless the TB is cured completely, the sinus is not going to be cured. Persistence of a malignant disease or post-irradiation can also be another cause for the persistence of a sinus. Moving on to the investigations which have to be carried on to rule out the sinus, we have the sinusogram. Sinusogram is done using an ultra-fluid lipiodol or water-soluble iodine dye. Lipiodol is poppy seed oil. You can see the lipiodol ultra-fluid which is given in the picture, which is the poppy seed oil which is containing 40% iodine. So this lipodol ultra fluid is used, and then we perform the sinusogram. Moving on to the next investigations, we have the discharges coming out from the sinus which have to be given for the cytological study, AFB cytology, as well as the staining. Acid fast bacilli stain and everything have to be done. Biopsy from the edge of the tuberculosis and malignancy. So if the sinus is there and it's a condition of TB, we need to take the biopsy so that we can find out if there is any malignancy or tuberculosis. Investigations continuation, we have to take a chest x-ray and x-ray of the part on for which the sinus is present, and MRI is the most reliable one. ESR should also be done, okay. The other investigations, we have CT sinusogram, as we discussed. We have CT sinusogram and probing gently with the care. Moving on to the last part, that is treatment. So the sinuses, we need to treat the cause. If there is actinomycosis, tuberculosis, chronic osteomyelitis, treat the cause. If there is an abscess, drain it, okay. You need to treat the cause to treat the sinus. The excision of the sinus need to be done. Just example, we can take the median mental sinus. In that, the excision has to be done. And then always the specimens should be sent for the histology, like we studied in the investigations. All the specimens or the tissues which have been extracted should be sent for the histological study to rule out the malignancies. Antibiotics should be given, anti-tubercular drugs if the person is subjected to tuberculosis. Adequate rest and the adequate drainage need to be performed. Okay. So thank you guys. With this we come to an end of sinus. In the next part we are going to deal about the fistulas. I hope you like the video. If you have any queries, put it in the comment section, and if you like my video, hit the like button and